I knew that I definitely wanted a bladder suspension, and being that they were going to, um, have a abdominal incision because my uterus at that point, it was too large to take out of my vagina for a vaginal hysterectomy or laparoscopic. My bladder was, I mean, not my bladder, I'm sorry, my uterus was like a 6 month pregnant uterus. So being that I was going to have an abdominal incision, I wanted to go ahead and get the bladder suspension as well. So I opted to wait. The urologist was going to be back in town in just a few days, so I went on bed rest. Um, it was the longest 6 days of my life. I continued to bleed. I took iron, supplements, tried to take in fluids. Before my surgery, I was severely anemic, a normal hemoglobin level. I'm sorry, hemoglobin level. Anything 11 or 12, particularly above a 12 is good. Um, Prior to surgery, mine dropped down to about a 5. I had to be transfused during the operation. I had to have multiple transfusions after the operation. I lost minimal blood during the operation thanks to my surgeons. I had two, my urologist and my urogynecologist. They worked together as a team. And due to their expertise, I had minimal blood loss. It was just from all the bleeding from the 2 weeks before. And so that set me back a little bit. Um, Due to my autoimmune disease, I have allergies to multiple medications. And so I was limited on what I could take afterwards, which really made it hard as far as pain control. They gave me a block in my spine before the surgery. When they first took me into the OR, I only remember bits and pieces because they gave me Versed, which gives you basically amnesia. You can still follow commands and do the things they ask you to do, but you don't remember any of it, and there's no pain. Um, so that was basically, to numb everything from the belly down. The thinking with that is that usually they give you like a PCA pump. You just push the little button for pain management control. They put a pain med in there. But um, with all the surgeries that I had, they felt that, or they know that the pain pump just cannot keep up with the pain that you're going to have in recovery. So they gave me the block. Lo and behold, it only worked from the top of my vagina to the bottom. So I came out of surgery and in recovery in immense pain from my belly. They couldn't give me a PCA because it had to be post 24 hours from the block. Um, Respiratory depression and all those things. So it was rough. I'm just going to say it was the first 3 days post op were very, very rough. Eventually, they were able to give me the PCA pump. 24 hours later, I had no foods for the first 4 hours. My surgeons are old school. They don't believe in feeding until the bowel's completely awake. Then after that, they want you on liquid diet for several weeks. So it was rough. I'm now a month out. I'm feeling much better. Then my incision in my abdomen healed perfectly. I have some soreness in my stomach and in my back. But that part, I feel really good. The vajayjay, let me just say, like I said, when I had my daughter, I was a teen mom, 16. It was traumatic, extremely traumatic. Um, I had a huge laceration to an inside of my internal wall. I had lots of internal sutures. Nothing compared to this, okay? I will say, aesthetically, I love the new look. It is pre-baby, which is nice. So it looks very pretty. But the swelling and the internal sutures that are absorbable, it hurts. Hence why I'm laying down. And I'm a month out. The more you stand, the more you sit, you get a lot of swelling. I describe it frequently. Sorry, I'm blunt. As I feel like a bowling ball is stuck in my VJ and in my butt, and it's gonna come out, which is typical. I haven't had any bleeding. I did have a small dehiscence in my perineum, probably a half an inch long. 3 stitches were lost due to infection. It's pretty common. There's a lot of traffic in that area between when you pee, when you poo. It's just a hard area sometimes to heal, and despite all my best efforts in being on antibiotic, it just wasn't enough. So it's healing nicely. It's still not fully closed, but it will be. They switched my antibiotic. I only ran fever for about 24 hours. It cleared up the infection quickly, and so we're just waiting for second intention healing. Once there's an infection like that, they can, but it's best not to go back and resuture. So we're just waiting for that to heal. They gave me a hormone shot right after surgery. And then at my last visit, I see my urologist and my urogynecologist once a week, every week. He started me on estrogen. So I'm taking 2 milligrams every day. And I feel really good. My moods are really stable. I noticed in starting the estrogen that I feel hungrier. I feel sleepy, but I just feel really relaxed. And so that's good. I've always suffered from horrific premenstrual syndrome, mood swings. My cycles dominated my life. I don't know if it's always going to be this easy with hormone replacement therapy, as I have heard many horror stories. But at this point, it's good. I feel good. I'll be posting more videos on my recovery. To those of you that are facing this surgery, from a patient's point of view, I can tell you that I understand your fear. I understand your worries. I had them all and then some. I wasn't ready to let that part of my body and my womanhood go. As much pain as Big Marge, that's what I call her, and her 2 evil cousins, Flip and Pip, my ovaries. As much pain as they caused me, I was not ready to let them go. Rest in peace, Big Marge, you angry heifer. But I do understand. If anything, with this video, I would just like to share my story, my struggles, and ultimately my victories with you guys, answer any questions that you have. It's a hard road for us ladies. Men are lucky. They get a prostate. They get old, they can't pee. We have a uterus, we have a cervix, we have ovaries, we pee too much, we bleed too much. I would have rather had a prostate. but it's not what I got. So hang in there. You have to do what's best for you. Make informed, well-educated decisions. Don't put it off because it can be a harder recovery than originally would have been based on my circumstances. But I will be posting more videos. Comment below with your questions. I'll try and answer them as best I can. I'll be talking with you guys soon. Nurse T loves you. Peace out. Maybe. If I can turn it off. I told y'all I'm really new at this. Bear with me.